Dear ladies and gentlemen, thank you so much for the opportunity to introduce you the results of our study. There is no disclosure. The aim of the study is to validate the Caprini score in patients undergoing varicose vein surgery, especially endovascular procedures, and to identify individuals at the elevated risk of postoperative VTE who will benefit from prophylactic anticoagulation. This is analysis of ongoing registry study CAPSIFs, which include patients who underwent treatment for varicose veins for any intervention, and who is followed up for 28 days with ultrasound performed between 2 and 4 weeks to catch any kind of deep vein thrombosis, especially symptomatic VTE and intravenous EHIT-induced thrombosis. This analysis was performed in February 2022 with number of records 1878. You can find here demographical characteristics of the patients. The Caprini score ranged between 1 and 12 with a mean of 4, and the most important risk factors of the Caprini score you can find here in the presented diagram. VTE prophylaxis consists of elastic compression was used almost for all of the patients, and pharmacological prophylaxis was used for 20% of the patients. Any VTE event was detected in 63 patients, that is 3.4%. That was any DVT in 39 patients and EHITs in 28 patients. The location of DVT was presented mostly in the calf muscle veins, 1 case in peroneal veins and 5 cases in femoral veins. Bleeding was detected in 2 cases and were represented by clinical element, not major uterine bleeding, at the top of the prophylaxis with the dogs. There was a significant correlation between the Caprini score and the incidence of VTE, but we couldn't identify the cutoff of which specificity and sensitivity could predict the development of postoperative DVT. The logistic regression showed that age, Caprini score, treatment of tributaries, mini phlebotomy, sclerotherapy, anticoagulation, type and duration of anticoagulation are correlated with the development of postoperative VTE. However, in the multiple factor regression analysis on the treatment of tributaries, type of anticoagulation and duration of anticoagulation were predictable. Also, there was analysis between Caprini score in the patients who did not receive anticoagulation, and we found significant correlation and significant predictability without any satisfied cutoff which could predict the development of postoperative DVT. The regression analysis found the Caprini score treatment of tributaries could predict postoperative DVT. We tried to analyze which type of VTE could be predicted by Caprini score, and it were only EHITs, not any DVT or symptomatic DVT. Conclusions. The incidence of postoperative VTE after modern weight surgery is 3.4%. It is predominantly represented by symptomatic DVT and EHIT. The incidence of symptomatic VTE at 28 days is 0.5%. Caprini score correlates significantly with DVT, particularly with endovenous EHIT. But it's impossible to identify a specific threshold of the Caprini score to find patients who are at the high risk of VTE. Prophylactic anticoagulation is being used in 20% of patients, and appropriate duration of anticoagulation may correlate to other development of postoperative VTE. Thank you for your attention.